Hi, Caitlin.
Hi, how are
I'm
you?
Dr. Mad. How are you?
I'm doing okay. How are you doing today?
I'm good. Well, we do have an appointment here. It looks like you had an injury on your back.
Yeah, I did.
Okay. So, when did it happen?
It happened like 2 or 3 days ago. Over the weekend, I was trying to jump into a pool, and it was just too shallow, I guess. So I accidentally hit my shoulder as I was going in.
Okay.
It's my shoulder, but like more so my back, I would say.
Okay. So, left shoulder plus back. And have you noticed any range of motion problems?
Yes, it feels kind of swollen, and I can't reach as far as I normally would, and it hurts when I'm just sitting as well.
Okay. Did you take any medicine for it?
I did. I just took some ibuprofen.
Okay. Have you noticed any improvement with that?
The pain's a little bit less. It just doesn't seem to be healing that great.
Okay. And have you noticed any problems with your neck?
A little bit, yeah. But I just think that the area between my shoulders too is so tight that I don't know if when I move my neck it affects that as well. So
Okay.
a little bit, but it feels like it's like a little lower than my neck.
Okay, we're gonna go through other symptoms that might accompany this type of injury. Have you noticed any blurry vision,
No.
double vision?
No.
Have you noticed any floaters that are new?
No.
Okay. And any recent headaches after the accident?
There was a little bit of headaches, but it's more or less gone away now.
Okay. And was it radiating towards one part of the head?
No.
Or can you
Just
show
like a
me?
general, like,
in the
behind
front?
the eyes, kind of.
Okay, so frontal lobe. And have you noticed any shakiness?
A little bit in my left hand, but that also, at first, it's kind of gone away, though.
Okay. Any balance issues?
No.
Have you noticed anything leaking from your ears?
No.
Okay, so no leaking. And have you noticed any slurred speech?
No.
Okay. Any difficulty breathing through your nose? Was one nair more obstructed than the other?
No.
Okay. So I'm gonna go ahead and do a checkup first, see exactly where we stand. I'm going to check your reflexes. So for that, I'm going to ask you to relax your jaw. So a little bit more. Okay, good. And we're going to start with shoulders. Relax your arms all the way. Okay. And I'm going to lift your arms, so go ahead and relax it. Good. Good. Okay. Relax. All right. Go ahead and put your arms in front of you just like that. So what I'm going to do is I'll try to lower them. Don't let me do that, okay? Okay. Same thing at the same time. Okay. A little bit of imbalance on the left. Now I'm going to try to open them. Don't let me do that. Good. And I'm going to try to lift them up. Don't let me do that. Okay. Go ahead and squeeze my fingers. All right. I'm going to try to check your head now. So go ahead and relax. Okay. What I'm going to do, I'm going to try to push your head that way. I'm going to need you to resist, okay? Okay. And I will do the same thing on the other side. All right, I'm going to try to look down, and I'm going to push you up. Don't let me do that. Go ahead and look down. Good. And now go ahead and try to look up with the head, not just eyes. All right, that looks good. Can you please go ahead and shrug your shoulders?
Yep.
Okay. Now, I'm going to push your arm towards the middle of your body. I'm going to have you push it the opposite way, okay?
Okay.
Again? Okay. Okay. All right. The other thing, what I'm going to do is I'll have you kind of lean forward, but I'm going to push you in the back, so try to resist that, okay?
Okay.
1, 2, 3. Okay, good. And we'll do the same thing in the back. Give me 1 second. Okay, go ahead and lean back for me. All right, very good. Okay, we're gonna go ahead and do a vision check. Okay, go ahead and look straight in my nose. I'm going to flash a light in your eyes. We're checking pupil dilation and constriction. See if there is any kind of rhythmic changes. Okay, I'm going to lower your lid. Okay, good. Go ahead and follow the light with your eyes only to move your head. Okay, that was very normal. I'm going to have you cover one eye. Okay, and can you please tell me what you see right here?
A car.
All right. What about here in between my fingers?
Cat. Duck.
Okay, and what number do you see here?
47.
And here?
82.
Okay, go ahead and switch eyes. What do you see here?
A mug.
What color is it?
Blue.
Okay. What about here?
A star.
And what letter is inside a star?
E.
Okay. What number do you see here?
62.
And here?
34.
Okay. Perfect. I know you did say you haven't noticed any changes with your taste, so I do have here just a strip to double check. What I'm going to have you do is just taste it, and then I'll take it out, okay? What does that taste like?
Bitter.
Okay. And I'm going to cover one nostril. Go ahead and breathe in, breathe out. Okay, no. No obstruction there. Good. Go ahead and tell me what this smells like.
Lavender.
Okay. I'm going to ask you to close your eyes now. And tell me with which ear you hear this sound.
Left. Right. Both. Both.
Okay. Can you tell me which position here is closer to your ear? Position number 1 or 2?
1.
And same thing, position number 1 or 2?
2.
Okay, perfect. Okay, I'm gonna go ahead and check your blood pressure. Okay. Is this arm okay for you? Yeah. All right. I'm gonna have you uncross your legs. (118/60). That's good. So for the injury that you had, I think everything looks good so far. You do have diminished reflexes on the left side, but I'm gonna go ahead and have you turn around so I can check your back now, and we'll see how it goes. Okay?
Okay, thank you.
Go ahead and put your hair on the side. I'm going to just gently palpate from the base of the skull and move down to the injury area. Okay, I'm noticing inflammation at the origin of your thoracic spine. Any pain when I press down here?
A bit, yeah.
Is it radiating down or towards the shoulder?
Towards the shoulder.
Okay, I'm going to lower the strap of the shirt a little bit. Okay. Go ahead and tell me if you feel any pain radiating down the spine as I'm tapping.
I do, yeah.
So that's right here, okay?
Yeah. 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 Yeah, it does still hurt.
Okay, is it more intense or less intense than above the shoulder?
Less intense, but not by much.
Okay. Any pain here?
Yeah.
So this whole area is very sore. Okay, I'm gonna have you hyperextend your neck. So what I'm gonna have you do is try to push your head back as much as you can. Okay, that's pretty good mobility there actually. All right, go ahead and come back to center. And now move it down. So try to touch your chin with your chest. Okay, that's actually pretty good. Let's go ahead and take some measurements of that. Okay. Okay, go ahead and come back to center. There's a slight degree difference on the left side, indicating indeed some inflammatory process. Go ahead and tell me if you feel any kind of pain as I'm touching you with this object. Sometimes there's a response to the cold stimulus, and that indicates some nerve damage. Any pain as I did that?
No.
Okay, now I'm going to slide it down. Neck. Any pain?
No. 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 No.
Okay, so no nerve damage.
No.
Okay. Go ahead and tell me when you don't feel this vibration anymore.
No. 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 No.
Okay. Let's take some measurements. Okay. 51.2. It's 50. 48. 28.9. Okay, slight inflammation on that side. I'm going to check your sensations on your upper back. So what I'm going to do, I'll touch you with a sharp and a dull object. This is what sharp is going to feel like, and this is what dull is going to feel like. Did you feel them both?
Yes.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Dull. Sharp. sharp, 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 dull, dull, sharp, dull, dull, sharp, sharp, dull, 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 sharp, sharp, dull.
Okay, go ahead and tell me if you feel this sharp all the way.
Yes.
Okay, does this feel sharp?
It's hard to tell.
What about now? Does this feel sharp?
Yes.
And now?
Yes.
Does this feel sharp?
Yes.
And does this feel sharp?
No.
What about now? Does this feel sharp?
No.
Okay. Does this feel cold or warm?
Warm.
What about now?
Cold.
Good. And does this feel cold or warm?
Warm.
Okay. And now?
Warm. Cold. Cold. Warm. 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 Cold. Warm.
Does this feel sharp or dull?
Dull. Sharp. Sharp. Dull. 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 Sharp. Dull.
Okay. And we're going to compare on the other side. Does this feel cold or warm?
Warm. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm.
Okay, I'm going to touch you with a different texture now. I'm going to need you to tell me where exactly you feel it. So it can be left or right, up, down, in the middle. Try to be as exact as you can, okay?
Okay. Left. Left.
Was that left upper shoulder, middle?
I think middle. Left upper shoulder. Right upper shoulder. In the middle. Left lower shoulder. Right lower shoulder. Right top shoulder.
Okay. So what I'm going to do now is I will try to listen to your joints, see if there is any type of normal crepitus. And as I'm doing this, I'm going to ask you to gently move your head down and back up. This way we are mobilizing the spine and creating some space in between it. Keep doing that. I do hear some fluid buildup in between, indicating some degree of inflammation. I would say on a scale of 1 to 4, you're about a 4A. Okay. Good. Alright, so now what I'm going to do is I'll listen to your shoulder joint. So what I'm going to have you do is kind of like a rotational movement. So rotating it 360 degrees very slowly so I can hear the sounds, okay? Go ahead and you can begin. A lot of fluid buildup in here as well. Okay, now move the other direction for me, please. Okay, definitely. Okay, and now I'm going to go ahead and compare, see if we have the same amount of inflammation on the right side. So go ahead and try to move your shoulder 360 degrees. Good. Okay, and the other direction. A little bit slower than that. So I would say pretty good mobility there. Okay. I'm going to apply some anti-inflammatory oil. And I'm going to start working on the left shoulder primarily. It's going to feel warm. It's going to warm up with on the skin. Okay, so we're starting with some gentle stretching of the muscles in the joints, trying to create some free space in between the cartilages. Okay, I'm going to ask you to try to put your arm behind you and touch the middle of your back. So we're going to do the left side first. All right. Take a deep breath in and breathe out. Very good. Okay. Go ahead and relax your arm. To use cupping therapy to try to accelerate the healing process, bring in some blood flow to the area. This is where your sensations are definitely out of whack. It's going to be a little bit red after we use it. It just means that a lot of the toxins were able to be eliminated and brought to the surface, and they're just going to dissolve on themselves. To apply pressure therapy. So we're trying to activate the points that correspond to the axis on the nervous system. This is going to help to diminish some of that pain. Okay, this helps to break the fascia and help with the elimination of toxins. Let me know if the pain is too much. I'm going to not focus that much on that area. We were able to bring a lot of blood flow. That's going to help with the pain. Perfect, Caitlin. I was able to really move some of those joints in the back and tackle the sensorial part as well. There is some inflammation on the left side, and you're actually very lucky that it's just that those type of injuries can be very, very dangerous. And I'm glad that you're doing so well. What we're gonna do is I'll have you come back in about 2 weeks. We definitely need to do another stretching and some more massage.
Okay.
All right. And do you feel any better than?
Oh my gosh, yes. It feels so much better. The cupping felt so good too, as well as the massage. It was a little painful, but in a good way. So now it feels more mobile and there is no pain. So thank you so much.
You're welcome. Try to take it easy for the next couple of days, okay?
Thank you so much.
You're welcome. I'll see you soon.
Have a good day.